And now, let's start with the solid diet. After the pure diet, we start with the solid diet, and the solid diet will be the diet we will continue until we reach our objectives. For sure, we will have moments to make changes because, like I said, everybody is special. So that's why it is very important to stay in touch with us and informing us about your process to get help from us when you need our recipes. During the solid diet, we just have two rules actually. We should not forget about the separation rule, so separating the solids and the liquids, and at the same time avoiding carbohydrates. You can start to eat everything normally. You don't need to mash the food anymore. You don't need to use the blender anymore. For the breakfast, our priority needs to be the eggs, like before, but you can start to eat the whole egg now. So you can prepare omelets with vegetables like mushrooms or spinach. That will be a good idea. And you can still use all types of cheese. Like I said before, it will be better to continue with cheese that contain less fat. It will be easier for you to digest during the first period of your process. And you can start to eat avocado and olives as well. And you still have the porridge option for the days that you don't want to eat eggs, so you can still prepare porridge with fruits and you don't need to mash the fruits anymore. For the snacks, you can eat the fruits directly, but it will be good to peel them because the skin will be difficult to digest, especially during the first months. And you have a lot of different options. You can start to prepare smoothies. You can mix the fruits with oat, a little bit of milk, and leave the house. It's a quick option. And you can start to drink coffee as well. Like I said, coffee is prohibited for 3 months, so I'm talking about the decaf coffee without caffeine. But you should never forget coffee, decaf coffee as well. It's diuretic, so the days that you drink coffee, you need to drink at least 2 liters of water. Besides that, the worst thing that you can do to yourself is drinking coffee when you wake up, because all night long you get dehydrated, and when you start your day with coffee you get more dehydrated. So always start your day with a big glass of water, and then you can have coffee after your breakfast if you want, but no more than 1 or 2 cups a day. And for the lunch and dinner, our priority needs to be chicken, fish and red meat like before. You can prepare them however you want. You can boil them, you can do barbecues, grilling, steaming, using the oven. You can use air fryers, but you need to stop deep frying with oil. That's not good for your health. So this is one of the habits that we need to change. And you can start to eat legumes like chickpeas, beans, lentils, but when we prepare this kind of meals in Turkey, we call them the juicy meals. They always contain the liquid part. So now, unfortunately, you have the separation rule. That's why it will not be possible to eat the liquid part at the same time with the solid part. So you need to separate the solids and eat only the solids. For sure, after the second month, you can prepare these meals with tomato paste, spices, onion and garlic. You can have the sauce, but the liquid part we need to separate. And for the soups, it's the same. If you want to prepare a chicken soup, for an example, you have 2 options actually. The first option would be separating the solids, drinking the soup, and 30 minutes later you can have the chicken and vegetables. Or you can use the blender to mix everything very well to drink a thicker soup like a cream, like a lentil soup actually. And you can start to prepare salads with chicken, with fish, with red meat, different vegetables, salads with a lot of color. But raw vegetables can be difficult to digest. So you need to try. If you don't have pain and uncomfortable feelings, you can keep going with the salads if you don't have gas. But if you feel gas, pain, uncomfortable feelings, you need to stop and keep going with the cooked vegetables. Like I said before, it is very important to prepare different meals with the good options of foods. And whenever you need ideas, recipes, we will be here to help you. Before we finish, I will remind you about some important points once again. I will repeat. Drinking water, very important for you. With the separation rule, it can be more complicated, so you need to always have the water bottle with you. And the first thing that you need to do when you wake up is drinking water. Fizzy drinks like Coca-Cola, Fanta, Sprite, Red Bull, please forget about them. These are like poison for you. So the surgery is a great opportunity to change these bad habits. We can replace them with natural fruit juices, kefir, ayran, Actimel, other options like lemonade. It contains sugar or iced teas, but sometimes to have fun, it's okay. And alcohol. Alcohol is prohibited for the first year. After the first year, if you have a special event, the best option would be red wine or gin. For sure, we are humans. We will have days that we will enjoy. We will have days that we will not have enough motivation to continue, but you should never forget the most important thing is the general balance and discover your body. Learn more about nutrition and your body. If you do that, if you find your balance, you will reach your objectives, and then the most important thing, you will maintain. We will be always here with you to support you during this journey, and I'm sure that if you take this decision to change your life, you will be successful and you will have our support. So that's it for today. We will see each other in the next videos. If you have any questions, please don't hesitate to use the commentary section, and at the same time you can reach us from WhatsApp. Our patient coordinators are waiting for you to inform you about all the processes, and see you in the next video. Thank you for your time.